Hi, my name is Kirsten, and today I'm going to be demonstrating performing trach care. So the first thing you're going to want to do is gather all of your supplies, and then you're going to do your initial steps like providing patient privacy, and then you're going to introduce yourself to the patient and wash your hands. And then you're going to verify their name and date of birth and compare it with their wristband. Perfect. Okay. So the gloves that you're going to start out with are just going to be clean gloves. So I'm going to put those on. Okay, and then I'm going to open my tracheostomy kit. And I'm going to pour my solutions into it. So the first solution we have is hydrogen peroxide. You're going to put this in one of the containers and only fill it about halfway. Then you're going to take your normal saline. I'm checking the date, and I'm going to lip it because it's already been opened. Okay, and then you're going to put the normal saline in with the hydrogen peroxide and in the other container as well, and you'll use that for rinsing. Okay, so I would normally put a mask on, but I don't think you'd be able to hear me very well in the video with it, so I'm just going to set this aside. But anytime you're performing trach care or anything with a trach, you're going to want a mask and potentially a gown on. Okay, so you're going to come over here and you're going to take the trach out of the patient very gently. This one is a disposable one, but for the sake of the video we're going to pretend like it's reusable just so that we can show you how it would be cleaned. And you're going to drop it in the mixture of hydrogen peroxide and saline, and then you're going to take your clean gloves off, wash your hands, and then you're going to open your sterile gloves. And put those on. Okay, so once you have your sterile gloves on, you are going to clean the reusable trach. So in here you have a brush. And the brush is going to be used to clean the inside of it. And then you should clean the outside as well. Okay. And then to rinse it, you put it in just the normal saline. And you're going to use the pipe cleaners to dry the inside. When you do that, you want to put both of the pipe cleaners together and insert them. And then you use the 4x4 to clean the outside. Or to dry it. Okay, and then we're gonna be putting this new one in. So I'm gonna come over here. Put it in like that, and then the next thing that you want to do is clean the outside. So you're going to do that with these cotton applicators, and you want them wet so you can dip them in the saline. And you're just going to clean the outside until there's no crust or anything. And once you've done that, you can change the bandages. So you're going to take the tie off first. And this glove doesn't need to be sterile anymore, so I'm going to lift up the patient's head. Take that off, and you want to keep a hand there so that it doesn't, if they cough, the trach doesn't come out. So then you're going to put the new string on. And you're going to tie it on the side just to make sure that it doesn't come off. Okay, and then the next thing that you're going to change is this gauze down here. So we're just removing this old one. And you put the new one underneath it like that. And then you can take your gloves off and throw away your garbage. Open the curtain, make sure the bed is down, ask the patient if they need anything else and if they're comfortable, and then you would report and record.